Hi, I'm Morgan. I'm going to be your student nurse today. Can I go ahead and start by just getting your full name and date of birth? Okay, and that matches what I have here. Do you have any allergies besides the penicillin allergy? No? Okay, perfect. So I'm just going to start by asking, or telling you, so we're going to be doing an IV insertion here, and we're going to be doing it in your right forearm. We have some antibiotics that we're going to be giving you for the fluid in your lungs, and then some normal saline. So I'm just going to be working on getting your IV put in here. So I would have a protective pad under the patient's bed. I would ensure privacy, and then I would also have them in a low Fowler's position with their arm lower than their heart. So I'm just going to go ahead and get started, and I already did hand hygiene. So I'm going to put my gloves on and then start getting my tubing ready. And this has a cap on, so I would take that cap off and take this cap off because those are both sterile, so be sure not to touch them. And then since this part is exposed, that's where I'm going to attach my saline flush. So I'm going to swab that just for safety. Attach my saline flush. And then I'm just going to have this sit back down here until I'm ready for it. So now I'm going to be looking at the arm. I'm going to go ahead and tie my tourniquet here. And being sure not to occlude blood flow here. So check to make sure the radial pulse still good. I'm gonna palpate here, and I'm thinking this vein is looking like the one I'm gonna choose. So take these off. I'm gonna get ready to clean the site. Do hand hygiene again. And get some new gloves. You doing okay? Okay, perfect. Okay, so I'm gonna open my kit should already be open. I already used my tourniquet. So I'm gonna get the ChloraPrep and be sure to not touch the site again, and then I'm gonna go up and down motions, being sure to thoroughly clean. And then I'm gonna let that dry normally for 30 seconds. Be sure that's all good. Okay, you doing okay? I'm gonna be sure to hold the needle and go in and at a 5 to 15 angle. Hold the skin top, but being sure not to touch. Okay. Touch that. Okay. And then being sure to hold this in place, I'm gonna go ahead and back pull and check for return. And then I'm gonna flush. I'm gonna undo the tourniquet here. And I'm gonna flush the line. Okay. And then I'm just gonna keep holding this here and then securing it. And then I'm going to tape. I'm gonna use my clear dressing, and I would tape this down, being sure the access site is still available. And then I'm also going to tape down the tubing to make sure it's not being pulled around. And then I would also tape down the date and the time and the access point and all of that. Do you have any other questions? No? Okay, thank you.